बिस्मिल्लाहिर्रहमानिर्रहीम। इय्याका नअबुदु व इय्याका नस्तईन। अल्लाहुम्मा सल्लि अला मुहम्मदिन व अला आलि मुहम्मदिन व बारिक वसल्लम अलैहि। Dear colleague, I am Dr. Sultan Aju, working as a radiologist. This is a male adult, almost 40-year age, with history of feeling of lump at the upper abdomen in the midline. So I am going to scan the upper abdomen, means epigastric region, up to the umbilical region. First, we are going to define what is the epigastric region. This region extends from the xiphoid process to the umbilicus. So this is the epigastric region from the xiphoid process to the umbilicus or umbilicus, you can say. And so I have placed the probe at the epigastric region near the xiphoid process. Here we can appreciate the rectus sheath. What is rectus sheath? It is the thick fibrous band which is formed by the union of lateral abdominal wall muscle. And what are the lateral abdominal muscle? Which are these? Number one is the external oblique. Number two is the internal oblique, and number three is the transverse abdominis muscle. So these three muscles, with the help of aponeurosis, they unite to form the rectus sheath. This is the external oblique, then is the internal oblique, and then which transverse abdominis, which is close to the peritoneum. These form the rectus sheath. Then this rectus sheath is divided into the anterior and posterior portion. We usually call it anterior rectus sheath and posterior rectus sheath. So this is the rectus sheath, and then this rectus sheath surround the rectus abdominis muscle on the right side and on the left side. This is the rectus sheath anterior, and this is the posterior rectus sheath, and this is the rectus abdominis muscle. And this rectus sheath with the internal abdominal rectus abdominis muscle, this unite to form the linea alba in the midline. So rectus sheath from the right side and rectus sheath from the left side, they combine to form the linea alba. This linea alba as well as the rectus sheath extend from the xiphoid process to the pubic symphysis. So this was short anatomical detail. And now this is the xiphoid process. I have placed the probe below the xiphoid process, and then I am dragging the probe downward up to the umbilical region. Slowly I am dragging the probe. This is the rectus abdominal muscle surrounded by the rectus sheath. Gradually I am dragging the probe gradually downward, and here you can appreciate this is the linea alba, and Look at here. Look here slowly. It is gradually this continuity of the linea alba is disrupted. Here you can appreciate. Again, this is intact, and when I slightly move downward, here you can appreciate continuity is disrupted. So this is the defect in the linea alba at the anterior abdominal wall. So we can say this is the defect in the linea alba at the epigastric region. So whenever there is a defect in the linea alba at the epigastric region, defect may be from the xiphoid process to the umbilical region. So we should then measure the distance where the probe positioning is, and from the xiphoid to uh, site of defect, or from the umbilicus to the site of defect. We should measure this is the 3 centimeter, 2 centimeter from the xiphoid process, you can say, or from the umbilicus. As uh, any can have this option, any can use this option, can measure from the umbilicus to, or measure from the xiphoid process. So this is the, we can appreciate the, again I am doing it. Dragging the probe downward, here we can appreciate something abnormal is coming, and then again downward. This is this. Look here. This is the defect. Discontinuity. This is the continuous, and this is the discontinuity. Again, I am going to show you. Look here. This is intact, and this is defect. Look here. Look here. So now the defect is, let's see, and this we can appreciate. So what is a hernia? I can define it. There is a, when there is a defect or weakening in the anterior abdominal wall through which some organ or tissue is projected outward from the abdomen through this defect. So this is the hernia. We can say it protrusion of abdominal content, maybe tissue, maybe organ, through the defect, then in reaching the skin region or the subcutaneous tissue. This is called hernia. And hernia has 3 components. Number 1, the defect. This is the defect. This is the neck of the hernia. Then other is the sac of the hernia. This whole area is the sac of the hernia. And the 4th component is, third component is the, what are the contents within the sac. So first we should measure the neck of the hernia from here to here. and then the sac size, transverse diameter, and then we should also tell the contents, which may be pre-peritoneal fat, and then maybe some vowel loops, maybe omentum. So these may be the herniated contents. So this was the about the epigastric hernia. What is the region, epigastric region, where it extends and where it ends. So it starts from the xiphoid process to the umbilical region. Again, I'm going to show you. Look here. This is the boundary of the sac, and these are the contents. And this lump is appearing, which the patient is feeling. Look here. This is the normal subcutaneous fat, and this is the sheath, linea alba, and this subcutaneous fat. When we move downward from the xiphoid toward the umbilicus region, and on the way we appreciate this lump. This is the subcutaneous, sorry, this is the fat which has been projected outward through the defect. And look here, this is intact, this one is intact. When we move downward, this continuity is disrupted here. We can appreciate. So this is the patient is not increasing the intra-abdominal pressure. So defect is too large that without valsalva maneuver, we can appreciate it. Sometimes defect is very small, we cannot appreciate. So ask the patient to increase the intra-abdominal pressure while coughing, ballooning of the abdomen, or patient always should be in the spine position, and you should measure the defect in transverse direction and in the longitudinal direction. So this is the, again I am going to show you. This is normal, intact wall, intact linea alba, intact sheath, and then when we move downward, this continuity, it is splitted. You can see this one is the, and then here this is the. So this is the, in between this is the defect. This is the rectus sheath, and this is the rectus sheath. Here is the no continuity, disrupted, defected area. So this was all about the epigastric hernia. Intact lump and defect. Thank you very much.